I have more passages from Healing Sex, a somatic therapy-based book for healing sexual trauma. The information that you receive from your body in the form of sensations, feelings, and intuition is key to the process of making choices. Survivors often learn to override their feelings and acquiesce to others' wishes. I want to invite you back into your body now. From inside your own body, you can decide what you want sexually based on your own needs, desires, and values. I call this embodied consent. New passage. Sometimes there are a number of seemingly contradictory feelings happening in your body at once. You may feel sexually turned on in your hips and vulva and feel pulled away in your chest. You may feel a warmth in your solar plexus, indicating the go-ahead, and be afraid or tight in your throat. So what do you do then? Actually, experiencing contradictory feelings is familiar territory for most survivors. Consent then becomes a matter of distinguishing what sensations are what. One workshop participant noted, "I feel the consent to be sexual in my belly. It is a settled and sure sensation. I can feel anxious in my chest at the same time. I am anxious when I am getting too close to someone. I can count on this happening. It does not mean that I do not want to be sexual. It just means that I am feeling scared while I'm being sexual." Another survivor shared, "I usually stop having sex when my stomach gets tight. I see now, though, that my stomach being tight is me feeling stressed about being turned on. It was so awful to get turned on during the abuse that my body still tries not to get turned on. If I relax and acknowledge my stomach and the fear that is there, I can go right on being sexual. My stomach being tight does not mean I do not want to have sex." Obviously, the point there is it's different for everybody. Passage on communicating consent. This one I am going to show in a screenshot because some of the words in here I do not want to say on the internet. It is basically a practice of saying certain things out loud for the sake of practicing getting comfortable. Basically saying yes, saying no, negotiating the details. If these things are uncomfortable to you, even when nobody is listening, like that can tell you something. New passage. Do you respect your own boundaries and sexual desires? Do you edit your needs or think of yourself as bad for having your desires? Practice respecting yourself as you would ask others to respect you. New passage on healthy risks. Healthy risks are choices that take into account both your well-being and your desire for growth. Pushing up against old limitations in order to allow more pleasure and choice into your sex life is key to sexual healing. Healthy risks push you past your comfort zone without challenging you beyond what you can handle. Many survivors say that they just want sex to feel safe. Unfortunately, having as your goal sex that is unthreatening and comfortable will keep you stuck. Because of the nature of sexual abuse and trauma, as you heal sexually, you will necessarily pass through times of discomfort and fear. As you take healthy risks that increase your pleasure and your choices, you will feel all the old fear, loss, and anger. This is normal. With each new sensation you allow yourself to feel, your sexuality will be freed from the control of the sexual abuse. What is your default behavior? Do you tend to automatically say no to sex? Or do you say yes without actually asking yourself whether you want it? If you are more likely to say no to sex or new sexual experiences, taking a healthy risk may mean pushing the envelope. What is one risk that you can take sexually that will bring more freedom and choice into your life? You may want to risk buying some sexy clothes and even wearing them on a date. Maybe you can risk initiating a sexual experience of your own design or even a conversation with your lover about sex. What will expand the constraints on your sexual expression while not pushing you beyond what you can handle? If you are more likely to say yes and you have a harder time finding your no, a healthy risk for you may be setting a sexual boundary. You might risk not having sex if you don't want to, when you might have normally talked yourself into it. You might say no to a new sexual experience that would push you too far. Maybe you could have a conversation with your lover about your boundaries. What would you say no if you could say no to anything without any negative consequences?